Morning, all of you. Today I will discuss about the topic is hepatitis. First of all, discuss the learning objectives of this topic. Based on the content in this chapter, two readers should be able to like what is hepatitis, pathophysiology of hepatitis, types of hepatitis, sign and symptoms of hepatitis, diagnostic and evaluations test of hepatitis, and last one is treatment of hepatitis. These are the learning objectives of this topic. Next one is learning outcomes of this topic. Like by the end of the lecture, the student should be able to understand like what is hepatitis. Next one is pathophysiology of hepatitis, types of hepatitis, sign and symptoms of hepatitis, diagnostic and evaluations test of hepatitis, and treatment of hepatitis. These are the learning outcomes of this topic. Next one. First of all, discuss about the what is hepatitis. What is hepatitis? Hepatitis means inflammation. Hepatitis means inflammation of the liver. Hepatitis means inflammation of the liver. Hep, hepat means liver and it is means inflammation are called hepatitis. Viral hepatitis means there is a specific virus that is causing your liver to inflame, means swell and become larger than normal. Hepatitis, in which hepatitis specific virus that is causing the liver inflammation and cause swelling and larger than normal. Inflammatory liver disease. Inflammatory liver disease characterized by jaundice, abdominal pain, and anorexia due to viral infections caused by virus A, B, C, D, and E, and alcohol abuse various toxins and various toxins. These are the positive agents of hepatitis and inflammatory liver disease. This is the normal liver diagram and this is the inflamed and enlarged liver. It means this is the hepatitis liver, inflamed liver and swell and enlarged liver. Next one. It is located in the upper right quadrant of the abdomen, in which example of toxin cause hepatitis like carbon tetrachloride, a substance called vinyl chloride used to make a plastic, the herbicides, peroxide, and group of industrial chemicals are called polychlorinated biphenyls. Next one is quadrant. Quadrant. Quadrant means is the region enclosed by the intersection of the x-axis and y-axis. So every plan has four quadrants divided into four parts. Quadrant. Four parts. First one is quadrant first. Second one is quadrant second. Next one is quadrant third, and next one is quadrant Fourth, these are the types of coagulant. Next one, cleanse the blood. Next one, cleanse the blood. Cleanse the blood means the liver play the most significant role. The liver play the most significant role in cleansing the blood. A healthy liver not only filtered toxin and unwanted byproducts from the blood, but also pulls nutrients from its to deliver to the body. It means clean the blood. And next one is the regulate hormones. Regulate hormones means the liver regulate the balance of sex hormone, thyroid hormone, cortisol, and other adrenal hormones. If transform of remove any excess from the body. Next one is helps with blood clotting. Helps with blood clotting means this liver is responsible for producing most of these coagulation factors. Means help with blood clotting. Next one is bile, produce bile. Liver is produce the bile and stored in gallbladder. Bile production is by the liver and stored in the gallbladder. Next one, produced important proteins. Produce important proteins. Liver are produce important proteins. The liver produce most of the proteins. The liver produce most of the proteins found in blood. Albumin is major protein. Albumin is major protein made by the liver that play an important role in regul- role in regulating blood volume and distribution of fluid in the body. Fluid in the body. Next one is maintain blood sugar level. Maintain blood sugar level. Maintain blood sugar level. The liver both stores and manufactures glucose depending upon the body needs. According to body needs, liver are manufactured glucose. And next one is and much or more, and the liver is essential for the life. The liver is the essential for the life. This is the location of liver in the abdominal cavity. Next one, pathophysiology of hepatitis. Pathophysiology of hepatitis. How to cause hepatitis? Caused by acute viral infections, toxicity, and or drug induced. Hepatitis caused by acute viral infections, toxicity, or drug induced. Liver is enlarged after the causing acute viral infection, toxicity, or drug induced. Liver is enlarged and congested. Liver is enlarged and congested, and disorientation of lobular pattern result in increased portal circulation pressure, and circulation then decrease to liver. Circulation then decrease to liver, and edema of biliary channels then cause result in obstructive jaundice. Result in cause obstructive jaundice. Next one, primary causes of chronic liver disease. Primary causes of chronic liver disease like Maximum hepatitis caused by the hepatitis C virus 26% and 25% hepatitis caused by the excessive alcohol consumptions. And next one 17% unknown causes of hepatitis. And next one is hepatitis C, 14% caused by the hepatitis C virus and both hepatitis C and alcohol. Next one is hepatitis B virus cause 11% of liver disease, and hepatitis B and alcohol cause 3% liver disease, and other 5% liver disease are caused by the other source of. Next one is types of hepatitis. How many types of hepatitis? Hepatitis, first one type is hepatitis A, means infectious. It means hep, infectious. Hepatitis A is a infectious hepatitis. Hepatitis B is a serum hepatitis, and hepatitis C is a non and non B or post transfusion hepatitis, and hepatitis D is with hepatitis B, and hepatitis E is a epidemic hepatitis. Epidemic hepatitis. Next one is hepatitis A. Hepatitis A is caused by the hepatitis A virus. Hepatitis A caused by the hepatitis A virus, and humans as their reservoirs, and source of contamination is infected feces. Source of contamination of hepatitis A is infected feces and HAV contaminated foods. HAV contaminated foods. HAV means hand arm vibration. Hand arm vibrations, and portal of contamination is period of contamination is 1 to 2 weeks before the onset of symptoms until about 7 days after the patients become joined. This next one is incubation period of hepatitis A. Incubation period of hepatitis A is 18 to 45 days, and immune globin within 2 weeks of exposure. Immune globins with 2 weeks of exposure. Next one is sign and symptoms of hepatitis A. Sign and symptoms of hepatitis A. Most are anicteric and asymptomatic. Most are anicteric and asymptomatic signs and symptoms of hepatitis A. Anicteric means not affected by jaundice. Anicteric means not affected by jaundice, and asymptomatic means producing or showing no symptoms. Next one is flu-like URTI with low-grade fever. Flu-like URTI means urinary respiratory tract infections. URTI means upper respiratory tract infections. A common viral infection that affect the nose, throat, and airway. Upper RTI, upper respiratory tract infections usually resolve with several days. Next one is anorexia. Next one is anorexia means loss of appetite. Indigestion means discomfort in abdominal discomfort in abdominal cavity and nausea, aversion to cigarette smoke and other strong odors. Aversion means a strong dislike and dislocation. And next one is may or not be jaundice. Hepatitis A cause and no might be jaundice. Next one, pathogenesis of hepatitis A. First of all, viruses pathogens are entered into mouth, then cause viral application in the liver, and after that replication in the liver, virus present in blood and feces 10 to 12 days after infections. After 10 to 12 days after infections, virus present in the blood and feces, and then virus excretions may continue for up to 3 weeks after onset of symptoms. Next one is diagnostic and evaluation test of hepatitis A. First one diagnostic test is blood test. Two kind of antibodies, two kind of antibodies to the virus, IgM antibodies and IgG antibodies. Next one is IgM antibodies show acute infection, IgM antibodies show acute infections, and IgG antibodies show previous infections or immunizations. Next one is management of hepatitis A. After causing hepatitis, how to manage hepatitis? There are no drug therapies for the treatment of acute hepatitis. Basically, no drug therapies for the treatment of acute hepatitis A. Next one, rest according to patient level of fatigue. According to level of fatigue, doctor prescribe the rest. Next one is hospitalization. Next one is hospitalization and small frequent feeding of a high calories, low fat diet and protein are restricted. During the jaundice, small feeding of high calorie and low fat diet and protein are restricted in jaundice. Vitamin K injection if prothrombin time is prolonged. Prothrombin time is prolonged. Prothrombin time is prolonged. Next one is IV fluid and electrolyte replacement therapy given by the doctor during the jaundice, and anti-emetic drugs are given in the treatment of hepatitis A. Next one is hepatitis B. Hepatitis B. Hepatitis B caused by the hepatitis B virus, HBV virus. HBV means hepatitis B virus. Reservoirs is humans and source of infection is infected individuals. Hepatitis B source of infection is infected individuals and receipt of blood transfusion. Receipt of blood transfusion or other blood products. Receipt of blood transfusion or other blood products. Next one is use of shared needles. Use of shared needles, and history of tattooing, ear or body piercings or acupunctures. Tattooing. Tattooing means make a part of body with a indelible design by inserting pigments into punches in the skin. And piercing means having a solving shrewdness and keen intelligence. And acupuncture. Acupuncture is a form of alternative medicines and key point of traditional traditional Chinese medicine in which skin needles are inserted into the body. Next one is incubation period of hepatitis. Incubation period of hepatitis is 30 to 180 days. And next one is period of communicability. Next one is period of communicability is hepatitis B is 1 to 2 months before and after the onset of symptoms. Next one is mode of transmission of hepatitis B is like heterosexual transmission, contact with blood and body fluids. These are the mode of transmission of hepatitis A. Next one is sign and symptoms of hepatitis B. Sign and symptoms of hepatitis B, like loss of appetites means anorexia, dyspepsia means discomfort in the upper abdominal part like nausea and flatulence. Next one is abdominal pain, journal facing malacia and weakness. Malacia means malaise means a general feeling of discomfort, illness, or unless whose exact cause is difficulty to identify, and enlargement of the hepatomegalia. Hepatomegalia means enlargement of liver, and splenomegalia means enlargement of spleen, and enlargement posterior cervical. Enlargement cervical means any viral any viral and bacterial infections of the upper respiratory tract. Any viral or bacterial infection of the upper respiratory tract or pharynx can cause enlargement, including mouth infections such as hepatic stenosis or dental infections, and posterior cervical or occupational may be caused by scalp infections of dermatitis like rosella and rubella infections. These are the sign and symptoms of hepatitis B. Next one is diagnostic and evaluations test of hepatitis B. First one diagnostic test is blood test, in which blood test perform the AST, ALT, ALP, GGT, serum proteins and prothrombin time, urinary bilirubin, urinary urobilinogen and total serum bilirubin. AST means aspartate aminotransferase enzyme. Next one is ALT, alanine transaminase enzyme. And next one is ALP, alkaline phosphate protein. And GGT means gamma glutamyl transferase enzyme. These are the enzymes evaluated in the blood test. Next one is serological test. Serological test. Serological test means an antibody test. Serological test is an antibody test looks for the presence of antibodies. Presence of antibodies which are specific proteins made in response to infections, and antibodies are typically detected in the blood of people who are treated after infections. They show an immune response to the infections. Next one is HBsAg. HBsAg means hepatitis B surface antigen test. H hepatitis B surface antigen test is a blood test ordered to determine if someone is infected with the hepatitis B virus, and if it is found along with specific antibodies, it means the person has a hepatitis. It means the hepatitis B infections. Next one is HBeAg, hepatitis B e antigen. Absence of HBe antibody usually indicate acute hepatitis B virus replication and highly infections. And next one is HBV, hepatitis B virus. Next one is liver ultrasound. Transient elastography can show the amount of liver damage, in which liver ultrasound show the amount of liver damage by the transient elastography. Transient elastography is a non-invasive technique that use both ultrasound and low frequency elastic waves to quantify liver fibrosis. Next one is liver biopsy. Next one is liver biopsy. Liver biopsy is a procedure to remove a small of liver tissue for laboratory testing. A liver biopsy is comparatively performed by inserting in the needles through your skin and into your liver. Next one is diagnostic test is fibro test. Next one diagnostic test is fibro test. Fibro test is a biomarker test that is used the result of 6 blood serum tests to generate a score that correlated with the degree of liver damage in people with a variety of liver disease. These are the diagnostic and evaluations test of hepatitis B. Next one is management of hepatitis B. Treatment of acute hepatitis B is indicated only in patients with severe hepatitis and liver failure. Rest and vitamin supplements and avoid alcohol. In which hepatitis B indicate only patient with severe hepatitis and liver failure is rest and vitamin supplements given due in the treatment of hepatitis B and avoid alcohol consumptions. Next one is treatment of chronic hepatitis B. Treatment of chronic hepatitis B. Nucleoside and nucleotide analogs such as tenofovir, adenofovir, lamivudine. These are the nucleoside and nucleotide analogs used in the treatment of hepatitis B. Next one is interferons. Interferons are used in the treatment of hepatitis. Standard interferons like intron A and polyglated interferons means polyintrons, pegintrons, and liver transplantation. Nucleoside. Nucleoside are the structural subunit of nucleic acid such as DNA and RNA. And nucleotides are building blocks of nucleic acid. DNA and RNA are composed of a nitrogenous base, a 5 carbon sugars like ribose and deoxyribose, and at least one phosphate groups. Next one is interferons. Interferons are a group of signaling proteins. Liver interferons are a group of signaling proteins. Liver transplantation interferons are a group of signaling proteins are released by host cell in response to presence of several virus and interferons with viral replications. Interferons means interfere with viral applications. Next one is liver transplantation. Next one is liver transplantation. Next one is hepatitis C. Hepatitis C virus. Hepatitis C caused by the hepatitis C virus and hepatitis C. Source of information of hepatitis C is parenteral drugs like needle stick injuries and blood transfusion. These are the source of infection of hepatitis C. And high risk sexual contacts like multiple partners and history of other sexual transmitted disease, anal sex, etc. These are the source of infection of hepatitis C. Next one is incubation period of hepatitis C is 15 to 160 days. And next one is contact with blood and body fluid. Contact with blood and body fluids, transfuse of blood and blood products. Incubation means the period of time between infections with germs and the appearance of symptoms in illness or disease means incubation time. Next one is period of communicability. 1 or more weeks before onset of symptoms, 1 or more weeks before onset of symptoms and persist in most persons. Next one is sign and symptoms of hepatitis C, like asymptomatic and experience mild symptoms during the hepatitis C and fatigue, abdominal pain, and poor appetites means anorexia, jaundice means yellowish mucus and discoloration of the skin. These are the symptoms of jaundice and headache, joint aches, muscle access, and nausea. These are the sign and symptoms of hepatitis. Next one is diagnostic and evaluation test of hepatitis C. Hepatitis C antibody test and HCV. Hepatitis C virus genotyping. Hepatitis C virus genotyping. Next one is management of hepatitis C. How to manage after causing hepatitis C. In a patient with acute hepatitis C, treatment with pegylated interferons with the 12 to 24 weeks of infections and reduce the development of chronic hepatitis C. Polyglinated Polyglinated interferons means usually are called PEG interferons is commonly modified form of the standard interferons that treats hepatitis C and reversive rarely hepatitis B. Next one is chronic hepatitis C virus, pegylated interferons, ribavirin, rabitol, protease inhibitors, such are Ilsavican, Bocaprevir. These are the treatment of management of hepatitis C. Next one is hepatitis C. Hepatitis B. Hepatitis B caused by the hepatitis B virus HDV and reservoirs humans like animals, chimpanzees and pigs. These are the reservoirs and source of infections like same as hepatitis B. Source of infection of hepatitis D is same as hepatitis B and incubation period of hepatitis D is 30 to 180 days, and period of communicability. Period of communicability. Communicability means period of communicability is the time during which an infectious agent may be transferred directly or indirectly from an infected person to another person. Period of communicability not been yet determined, but virus acceleration in stools has been demonstrated up to 14 days after onset of illness. Next one is co-infects with hepatitis B. Co-infects with hepatitis B and close personal contact and close personal contacts. Next one is sign and symptoms of hepatitis D. Similar those with hepatitis B and may progress to chronic active hepatitis and cirrhosis. Cirrhosis means damage the portion of liver and always associated with a coexistent hepatitis B virus infection and either simultaneous new infections like co-infections or a chronic hepatitis B infections, super, super infections. Next one is diagnostic and evaluation test of hepatitis D. Anti-hepatitis D virus test and hepatitis D virus antigen test and treatment of hepatitis B is interferons give in the treatment of hepatitis D. Next one is hepatitis E. Hepatitis E virus caused by the hepatitis E and reservoirs infected humans and animals while any domestic, especially swines, and incubation period of hepatitis E is 114 to 16 days and period of communicability. Period of communicability is not known and hepatitis E virus has been detected in stools 14 days after the onset of jaundice and approximately 4 weeks after ingestion of contaminated food and water and persist for about 2 weeks. After jaundice, 14 days detect the hepatitis C virus and after approximately 4 weeks after ingestion of contaminated food and water. Next one is source of infection of hepatitis E, like contaminated water and areas of poor sanitization, poor sanitation, and household numbers like sex partners, shared injections, equipments, and sign and symptoms of hepatitis E is jaundice is almost always present in hepatitis A. Next one is diagnostic and evaluation test of hepatitis E like anti-hepatitis EV, E virus like immunoglobulins AMS and immunoglobulins G that are the monoclonal antibodies are detected in the hepatitis E. Hepatitis E virus RNA quantification test. Next one is treatment of hepatitis E. There is no specific treatment capable of altering the course of acute hepatitis E. And as the disease is usually self-limiting, hospitalization is generally not required. Hospitalization is required for people with fulminant hepatitis. These are the treatment of hepatitis E. Next one is these are the references of hepatitis topic. Clinical Pharmacy, 10th edition, 2010 by P.N. Bennett. Second one is Clinical Pharmacy and Therapeutic, 5 September 2011 by Rogelwarkal catavithalasia. Next one is pharmacotherapy and physio, pathophysiological approaches, the Pro 7th edition, and Essential of Medical Pharmacology, Kati Tripathi, 5th edition, and Basic and Clinical Pharmacology, Pattern G. Goods and 11th edition, and Dragon and Dell Pharmacology, 6th edition, and Pharmacology and Pharmacotherapeutics, R.S. Sotagar, 20th edition. These are the references for hepatitis. Next one is multiple choice questions regarding the hepatitis. First one question is jaundice is caused due to. Jaundice is caused due to excess of uric acid in blood. Option B, excess of hemoglobin in blood. Option C, excess of bilirubin in blood. And option D, excess of potassium in the blood. The right answer is C, excess of bilirubin in blood. Bilirubin is a waste product released during the breakdown of option A is mast cell, option B RBC, and option C WBC, and option D platelets. The right answer is RBC. Bilirubin is a waste product of RBC. Next one is jaundice is also known as Icterius. Option A is Icterius. Option B hemophilia. Option C anemia. And option D hypercholesteremia. And option the right answer is A. Icterius means jaundice. Next one is hemolytic jaundice occurs due to option A is liver disease, option B rapid destruction of electrolyte, option C intestinal disease, option D all of the above. The right answer is B. Rapid destructions of electrolytes cause hemolytic jaundice. Next one is obstructions of bile ducts cause jaundice. Option A is true and option B is false. The right answer is A. Obstruction of bile ducts caused by jaundice is a true. Next one is jaundice caused due to obstruction of bile duct is also called option A is hemolytic jaundice, option B hepatocellular jaundice, and option C cholestasis, and option D none of the above. The right answer is C. Cholestasis is a caused by obstruction of bile duct. Next one is some of the most common symptoms of jaundice are option A is breathlessness, option B yellowing of skin, sclera white of eye, and darkening of skin. Option C is palpitations, and option D all of the above. The right answer is B. Next one question, jaundice can be diagnosed by. Jaundice can be diagnosed by blood test. Option A is blood test. Option B ECG. Option C is ECG, and option D is ELISA. The right answer is A. Blood tests are diagnosed the jaundice. Next one question is which of the following is most closely associated with bilirubin? Option A is RBC, option B T cells, option C lymphocytes, and option D B cells. The right answer is A. RBC is associated most closely associated with bilirubin. Next one question, blood incompatibility between the mother and baby can cause jaundice in newborn. Option A is true and option B is false. The right answer is A. Blood incompatibility between the mother and baby can cause jaundice in newborns is a true. These are the multiple choice questions of hepatitis and jaundice. thank you all of you for a wonderful session. Thank you, all of you.